they are running in losses with this type of the persons what they have fixed the prices, they are running in loss. So they are charging 50,000 per day. It's a huge amount. If a patient is admitted for 6 days, 3 lakh rupees. So those people, those who cannot afford it, we can have some small centers where isolation can be done under medical supervision, oxygen and their saturations can be looked after, and whatever the treatment is there, we can give the treatment, and it is giving very beautiful results. And we have seen that this strain which is present here is not that virulent when compared to the Western countries, where most of the patients, they are going into this ventilators. Here very few people are going into ventilators. Now in Italy, they have done a research on this, that it's not due to the virus, it's not due to the pneumonia, but there is some sluggishness in the blood which is giving to coagulation and also forming embolus or emboli or thrombus. This thrombus, when it goes to the heart, it is causing pulmonary embolism, and then the patient is dying due to heart attack. So after they have done postmortem of nearly 300 to 400 patients, they came to know that the clot is the one which is giving the patient the death. Death is due to the clot which is going and blocking the coronary arteries and also some arteries in the cerebral arteries. It will form stroke. When it goes to the coronary arteries, it is forming heart attack there. So now, after giving simple blood thinners like aspirin, clopidogrel, warf, and like this small blood thinners, it is giving beautiful results. The death toll has come down after giving aspirin. So now those ambulatory patients, those who are on ventilator, those who are not, who cannot move their limbs, Clexane is the drug, the injection, which is low molecular weight heparin. This is given 1 BD for 3 days. So any clot which is there in the body, that is getting dissolved. And beautiful results. The patients are recovering fast. Second drug which is giving beautiful result is dexamethasone. It is giving beautiful results. This can there are 3 types of this steroids. One is hydrocortisone. Then we have prednisolone, 5 times the potency, and 25 times the potency is betamethasone or beclomethasone. So now prednisolone is given 20 milligrams BD for 3 to 5 days to the patients. The inflammation which is taking place in the lungs, the pneumonitis or pneumonic symptoms, they are vanishing very fast with this. And the patient is drastically improving and the death toll is coming down. So these are the small measures which anywhere with some basic education, paramedics, nurses and educated people, they can look after this, and you can change the whole scenario. And there is no need for panic, there is no need for fear. We can have positive thinking, bold, and we have to follow simple norms, as our health officials, our Prime Minister is also telling that you have to maintain physical distance in each and every speech, and there are norms of the Health Ministry also, guidelines from the Health Ministry and the World Health Organization, WHO, that is giving them if you want to defeat this, isolation is there, social distancing, physical distancing, and also basic hygiene. Basic hygiene is the mantra of today, and I think with these simple measures we can win the battle against the coronavirus. And I advise all the religious leaders, all the teachers, all the social workers, paramedics, nurses and social activists to educate the people. Once you educate the people, educate the population, I think it will come down. I'll give you one simple example of New Zealand, which is 50 lakh population. There they have gone very aggressive, and they have changed the whole scenario. Now after 3 months, not a single case is there. With the last 1 month, New Zealand is free of corona. Likewise, in our state, in Kerala, they have overcome this very fast, but again due to the migration of the laborers and all this, that is spreading, and it is also due to their food habits. They drink hot water, That is in every Keralite drinks hot water, not the cold water, and they take lot of this Ayurvedic medicines. They take lot of spices, and they are all educated. Their primary health centers are well equipped, and there is aggressive policy from the government and the officials also, which has made it easy to overcome this corona pandemic in Kerala. This can be done anywhere with this experience. This is rarely, this is first time in the history of the mankind, after 2 or 3 big this pandemics, that the whole world is suffering, and lot of scientists, lot of engineers, lot of medical personnel, lot of professors, lot of research scientists, they are working to bring out the vaccine, which is not very far. Hopefully in the month of September we are going to make the vaccine. India is also ahead in the production of vaccine. Hope one day there is a company by name Cipla in India. They are just telling that they will bring out the cheapest vaccine, and once the vaccine comes, I think we can overcome this deadly disease. Hope my video is very helpful, very beneficial to you, and whosoever has came to know about the information which I have given, please pass on to our countrymen, to our neighbors, to our friends, our relatives, our students, and we can train so many students for this. And this is one of the ways to control this pandemic, deadly pandemic. I think we'll meet some other time with some other videos, some other clippings. Jai Hind.